Hello and welcome. In the embryonic period of life or the embryo development, you guys already know about that up to the 8th week, what are the structures arises, how our embryo forms. Okay. Now, to support the growth and the nutrition, we need an important structure which develops from the embryo along with the uterus of the mother. The structure is known as placenta. Okay, so you have to know about little bit details about placenta. In short, the definition of placenta is it's a discoid कोरियोडिसिडुएट ऑर्गन। मेरे कहने का मतलब यह है कि अब तक आप सबने जान चुके हो कि एम्ब्रायो मतलब भ्रूण कैसे तैयार होता है, कौन से हफ्ता में क्या क्या स्ट्रक्चर्स ओरिजिन होता है, क्या क्या बनता है, वगैरह वगैरह। ठीक है, तो ये जो भ्रूण बड़ा हो रहा है इसको सपोर्ट करने के लिए उसको न्यूट्रिशन चाहिए, मतलब पोषण चाहिए, ब्लड सर्कुलेशन चाहिए। ये सब कहाँ से होता है? ये सब होता है सिर्फ एक स्ट्रक्चर से जो बच्चे से, जो भ्रूण है, भ्रूण से पैदा होता है और एक हिस्सा माँ का यूटरस से पैदा होता है, उसका नाम है प्लेसेंटा। तो प्लेसेंटा का संज्ञा ये है कि ये एक डिस्क जैसा मतलब चक्की जैसा कोरियोडिसिडुएट ऑर्गन है। कोरियो मतलब इसमें कोरियन का हिस्सा होता है और इससे डिसिडुआ का हिस्सा होता है। व्हाट आई मीन इज कोरियो मींस इट इज एसोसिएटेड विद कोरियन एंड डिसिडुएट मींस इट इज एसोसिएटेड विद डिसिडुआ. What are these things? We'll talk about shortly. So by now you have know that the placenta has two parts. One is maternal component, one is fetal component. Now the fetal surface is shiny, translucent, and it is covered by chorionic plate and amnion. You can see the radiating umbilical vessels. And the maternal surface is rough and dark maroon color. Along with it has 20 to 30 segmentations. I mean, it's a lobular structure. Lobule. As you can see in this photo, you can see it's a cobblestone appearance. Each lobules are known as cotyledon, and these are covered by placental septa. A septa acts as a fissure. The diameter of the full-term placenta is almost 15 to 25 centimeter, almost 3 centimeter thick, and 500 to 600 gram weight. Now, before I proceed, you have to understand this chart that the placenta ultimately how it derives. Maternal component actually originates from the uterus. Uterus has three layers: endo, myo, and peri. Now, the endometrium. Remember one thing, during the pregnancy, the endometrium is known as decidua. If the woman is pregnant, you are not allowed to say the endometrial layer. You must say it's a decidual layer or decidua. Now, this decidua has three parts. First of all, decidua capsularis, which is also known as decidua vera, also known as decidua reflexa, and lastly our decidua basalis. It is also known as decidua serotina. Okay, from the fetal component we are getting the trophoblast and the extra embryonic mesoderm. From these two structure our chorion derives or chorion originates, and the chorion has two parts: chorionic frondosome and chorionic leaf. And the chorionic frondosome has intervillous space, chorionic villi. Now this chorionic villi, intervillous space, and the decidua basalis from the maternal part, all these three structure ultimately we call placenta. So remember this chart. As we proceed you will understand now how the placenta develops. Now in my earlier videos of the embryology I told you that the blastocyst has two parts. One is embryoblast and trophoblast. Trophoblast invades the decidua. What is decidua? As I said, it is the endometrial layer of the uterus during the pregnancy. Okay, never say endometrium, always say decidua at the time of pregnancy. Rest of the time you can say endometrium. मेरा कहने का मतलब ये है कि जो पिछले वीडियो में बताया था कि जो एम्ब्रायो है, एम्ब्रायो एक टाइम के बाद बनता है ब्लास्टोसिस्ट, और इस ब्लास्टोसिस्ट का दो पार्ट होता है, एम्ब्रायोब्लास्ट, ट्रोफोब्लास्ट। ट्रोफोब्लास्ट क्या कहते हैं? ये जो माँ का जो यूटरस है, यूटरस का जो डेसिडुआ पार्ट है, इसके अंदर घुस जाता है, इन्वेशन होता है. आफ्टर इन्वेशन ऑफ द blastocyst, I mean the trophoblast, the maternal decidua divides into three parts. First of all, decidua capsularis, then decidua parietalis, and then decidua basalis. Now, the lacunar phase and the trabeculae formation in the sensitive trophoblast ultimately leads to formation of the uteroplacental circulation. And the trabecula of the sensitive trophoblast ultimately invades the cytotrophoblast to form the ultimately primary villi. मेरे कहने का मतलब ये है कि ये जो ट्राबिकुलर फॉर्मेशन होता है सेंसिटिव ट्रोफोब्लास्ट के अंदर, वो एक टाइम के बाद साइटोट्रोफोब्लास्ट के अंदर घुस जाता है. घुसने के बाद इसको हम कहते हैं प्राइमरी विलाई फॉर्मेशन. आफ्टर सम टाइम द मेसोडर्म आल्सो इन्वेड्स द प्राइमरी विलाई टू फॉर्म द सेकेंडरी विलाई. नाउ एट द एंड ऑफ द थर्ड वीक the intervillous space formation occurs in the placenta. Now the chorionic villi, which are related to the Decidua capsularis, ultimately degenerates and becomes smooth. Now this smooth part of the chorion ultimately forms the chorionic leaf, and the chorionic villi related to the Decidua basalis grows too much, it spreads too much and ultimately forms disc-shaped chorionic frondosum. Okay, now the capillaries of the mesodermal core ultimately forms the tertiary villi. Now look at this chart, you can see that the chorionic villi has two types of classification based of the structure of the villi. You can see the primary villi, secondary villi, tertiary villi. Okay, and the chorionic villi has another separate classification based on their branching pattern. One is floating villi. This villi floats in the intervillous space. Then anchoring villi, truncus cori, which ultimately connects with the chorion and Decidua basalis. Okay, then you're gonna find rami cori, and lastly remuli cori. Overall classification of the placenta. First of all, based on their shape, you are getting, as you can see in this photo, discoid placenta, which is very normal and most common. Then bidiscoid placenta, lobed placenta, then placenta succenturiata, then placenta membranacea, and lastly the circumvallate placenta. Okay, another classification is based on their attachment of the umbilical cord. You are getting normal placenta, batellar placenta, and velamentous placenta. Another classification is based on their degree of adhesion. You are getting placenta accreta, placenta increta, and placenta percreta. Now the important thing is the function of placenta. First of all, gaseous exchange, then nutritional transport, third of all, excretion of urea, uric acid, and creatinine and other excretory products which are created by the tissues or the cells of the embryo. Fourth of all, passive immunity. Placenta also secretes very low amount of hormones like beta human chorionic gonadotrophin, beta HCG, then placental prolactin, placental estrogen, placental lactogen, and relaxin hormone. So this is the overall video of placenta. We'll talk about more about this placenta in clinical chapter, the obs and gynae part, not here. So see you in my next video. Till then, bye.